Hi, my name is Nur Iftita binti Hamzah. My metric number is 111612 and I'm from Faculty of Building Environment. Today I'm going to talk about mental health. So, do you guys know what is mental health? Mental health is our emotional, physiological, and social well-being. It is how we think, feel, and act. It helps determine how we handle stress, relate to others, and make healthy choices. Just like our physical health, it is important to all people at any age group. So, there's a lot of mental illness. Do you guys know what is mental illness? Mental illness is any disease or condition that influences the way a person thinks, feels, behaves, and relates to others and to his or her surroundings. This is stated from WHO. So there's a lot of factors for mental health, such as academic pressure, financial stress, social isolation, performance anxiety. Also, there's a lot of people who have relationship issues, homesickness, and lack of sleep because of students here have a lot of things to do. And then there's pressure to succeed, personal health issues, and social comparison. What is the sign of mental health issues? There is thinking or cognitive, emotion, behavior, and physiology. There's a lot of mental illness that I want to state here, such as schizophrenia, which is you're imagining things that aren't happening or
aren't there. Also, there's bipolar disorder, depression, generalized anxiety disorder, attention deficit hyperactivity disorder, or attention deficit disorder, obsessive compulsive disorder, or in short, people call it as OCD. Also, there's eating disorders, borderline personality disorders, autism spectrum disorders, and the last one is internet addiction, which is games, pornography, chat, and entertainment.
For today, I'm going to talk about anxiety disorder, which is a mental health condition characterized by intense, excessive, and persistent worry and fear about everyday situations that can interfere with daily life. What is the symptoms of anxiety disorder? It is intense and persistent worry. For example, people with anxiety disorder experience fear and worry that is out of proportion to the situation and difficult to control it. Second symptoms is physical symptoms. This can include restlessness, feeling on edge, fatigue, muscle tension, difficulty concentrating, and trouble sleeping. But it is different from panic attack. During panic attack, symptoms can escalate to include a racing heart, shortness of breath, and chest pain. Second one is interference with daily life. Anxiety disorder can impair a person's ability to function at school, work, university, and in social situations. But anxiety can be treated but cannot be cured. Some people might ask what causes anxiety actually. Anxiety can be caused by a complex interaction of factors, including genetics, brain chemistry, and person's life experiences, such as trauma, stressful events, or health problems. From genetic, anxiety disorder can run in family, suggesting a genetic component. But in brain chemistry, imbalance in brain chemistry and differences in how the brain functions or perceives traits can play a role. Life experience and environment. Post-trauma, such as abuse or witnessing a trauma event, can increase the risk of developing anxiety disorder later in life. Stress also can be cause of anxiety. A build-up of stress from life events like a death in the family, job stress, or financial worries can trigger anxiety. Also, childhood experiences, adverse childhood experiences can contribute to anxiety. There's a treatment to anxiety, such as psychotherapy and also medication. For psychotherapy, you can talk to therapy like CBT, which means a cognitive behavioral therapy, or medication. For medication, you can take antidepressants or anti-anxiety medication. But you can change your lifestyle, like stress management. There is techniques like meditation and deep breathing can be helpful for people with anxiety. For the next is diet. Reducing caffeine and alcohol intake may help manage symptoms for some individuals. And then there's also support groups. Connecting with others who have similar experiences can provide support and coping strategies. Why it can be treated but not curable? Anxiety disorders are often influenced by genetic factors that cannot be changed by treatment. Treatment helps lessen the severity of symptoms and increase the time between episodes, allowing you to regain control of your life. Living with anxiety is similar to managing other chronic conditions like headaches. While you may not be cured, you can significantly reduce the impact on your daily life with the right treatment plan. I think that's all for today from me about anxiety disorder, and then that's all from me. Thank you.